Good morning or afternoon. My name is Dr. Lisa Boss. I'm a student here at the University of Houston. I'm in the Doctor of Education program. I'm here today to present my thesis proposal to you, and the title is Simulation-Based Learning for the Development of Advanced Leadership Skills. I'd like to say thank you and acknowledge the work of my committee members. They're Doctors Robert Hausman, Sarah McNeil, Susie Gronseth, and Beth Ulrich. The agenda for today will follow these 6 topics. These 6 topics are the content that are in the first, second, and third chapters of the thesis proposal. So I'm going to go ahead and start with the problem. So every year I, as all the other faculty, go through all of our courses and look at the course structure and the objectives and the assignments to see if there's anything that we can do better. So this last time when I was going through it, I noticed there really wasn't any good innovative or active learning teaching methods for the way that we do our advanced nursing leadership skills. We pretty much are passive learning and do that just by didactic. So I went to the evidence and found that it indicates active learning, of course, is much better in terms of knowledge retention and creating a deeper understanding when compared to passive learning. The use of active learning approaches, such as simulation in particular, fosters engagement and self-directed learning. Also found that evidence supports the use of active learning in the development of leadership skills and promotes critical thinking, social learning, and retention of knowledge. The purpose of this thesis proposal is to examine the relationship of sim-based learning with professional competencies and perceived competence. I will also explore graduate students' experience with sim-based learning. My research questions are quantitative and qualitative in nature. So my first 2 are quantitative, and really they're intended to provide better understanding of the relationship between the use of simulation and the objective and subjective outcomes. Number 1 research question is, what is the difference in the level of perceived competence pre- and post sim-based learning activity? The hypothesis for that is that the level of perceived competence is significantly greater post sim-based learning activity. The next question is, what are clinical judgment scores related to performance competencies in graduate nursing leadership students? My third research question is qualitative, and it is, how do graduate nursing leadership students describe their experience of participating in the sim-based learning activity for nursing leadership skill development? So we're going to move into the significance, and I'll start with the significance of leadership. That's the main variable here. So leadership is a fundamental component in nursing practice. It's necessary in our crazy, complex, rapidly changing healthcare environment. That's really always been like that, but even in the last couple of years, it's been even more complex and rapidly changing before. We consider every nurse as a leader, so nurses in every role, from the bedside to the boardroom, must effectively demonstrate leadership skills, and those skills include high-quality care, systems improvement, collaboration, communication, teamwork, conflict resolution, and more. The mid-level nursing leaders, who are also called nurse managers, that's the common term, they have 24 accountability for the patient care units, and they're the ones who are directly responsible for creating safe, healthy environments that support the whole entire healthcare team and promote the optimal patient outcomes. So the real value of leadership lies with its known influence on the employee and patient outcomes. Effective nurse leaders provide a work environment that fosters employee empowerment, increased job satisfaction, organizational commitment, and enhanced teamwork. Optimal patient outcomes are also directly influenced by effective leadership, and that results in less incidence of falls, medication errors, hospital-acquired conditions, and less mortality. On the other hand, when we have ineffective learnership, we have subpar working conditions, heavy patient loads, limited employee participation in decision-making, high rates of employee burnout and turnover. Also, the negative work environment is consistently and significantly associated with poor patient outcomes and poor organizational financial performance, along with the increased adverse outcomes. So quality care and patient safety, no one can argue that this is not the main priority. So the main priority of every hospital system, every nurse, every person in healthcare is to achieve the highest quality care possible and have the best patient safety possible. So I want to go ahead and talk about the influence of leadership on different variables. So we'll just start with service-based industries. So leadership in the service-based industries in general is the cornerstone for organizational success. It's the most researched topic in the published literature for service-based industries, and those type of industries are hospitality, entertainment, and retail. There's an abundance of evidence in the service-based industry literature that supports the influence of leadership on specific and critical organizational performance measures that really apply to all organizations, and those are productivity, effectiveness, financial performance. Leadership is widely known for its influence on economic, political, and overall organizational success. And lastly, leadership skills and style are recognized as the most influential factors associated with any organization's success or failure. The influence of leadership in healthcare. So healthcare is also a service-based industry. The topic of leadership is also heavily researched and heavily documented in the healthcare literature. Much of the evidence shows that there are significant links between leadership and better frontline employee performance, organizational citizenship behavior, health, proactive behavior, innovative behavior, knowledge creation practices, and one of the most important things, less employee turnover. Also, evidence shows that leaders who create working conditions that foster employee engagement, autonomy, empowerment, and organizational commitment also build environments that just naturally have better patient outcomes, including less incidence of falls, medication errors, hospital-acquired conditions, and less morbidity and mortality. And for nursing, the influence of leadership on nursing is very great. So we know that nurses are commonly faced with unfavorable working conditions. And like I mentioned before, now is even worse than it's ever been. There are occupational hazards, workplace violence, the physical labor they go through, the occupational red tape, the low staffing, and the high performance expectations. And I would say since this pandemic began, the mental health toll that is taken on our nurses is incredible. To overcome these type of working conditions that threaten the physical and mental health of nurses, their leader has to be highly skilled and able to demonstrate clinical competency, of course, good communication, trust, and respect. If they have poor leadership skills, as seen in the laissez-faire leader, the absentee leader, ineffective leader, that directly impacts absenteeism, stress, emotional exhaustion, and intent to leave in employees. Also, emotional exhaustion in particular is recognized as the core element of employee burnout. It's directly related to low social support, demanding work, time constraints, arduous workload, and all of these are the ideas that are directly related to the employee perception of poor leadership. Perhaps the most severe and worrisome consequence of poor leadership is the adverse patient outcome. So there's plenty of evidence that shows hospital settings that have strong leadership, multidisciplinary collaboration, and employee empowerment have significantly decreased numbers of medication errors, healthcare acquired infections, patient complaints, fall, and even preventable deaths. Similarly, fewer adverse patient outcomes are directly related to quality patient practice environments, including 30-day patient mortality and failure to rescue, decreased catheter-associated UTIs, and decreased medication errors. So ultimately, the nursing leaders must create and maintain a work environment where employees are empowered, engaged, and motivated to provide high quality, excellent care. And that is a huge challenge in the state of our healthcare environment today, with uncertainty and change that happens almost every day. So because we know that the influence of nursing leadership skills is on employee performance and patient outcomes, those are the two main things, it is so serious that the nursing faculty from the MSN and Nursing Leadership Program ensure that advanced nursing leadership skills are taught to our nursing leadership students so that critical thinking skills, problem-solving skills, and knowledge are most effectively learned. So the goal when they graduate is that they graduate and they are ready to go and they can perform effectively. And I'm going to stop right here because this is 12 minutes. So thank you for listening.